Hi, Grace.
Hello, Hager.
How are you?
I'm fine.
Okay. So today we're going to have a discussion about randomized control trial.
Okay.
Okay, just I'm only going to take the lead.
Yes.
Okay, and then how to use the critical appraisal skills program.
Yes.
Okay, to critique a randomized control trial.
Okay.
All right.
Okay.
So when you want to critique any study, okay, first and foremost, you must read about the study you are being asked to critique.
Okay.
Okay, so today I've mentioned randomized control trials.
Yes.
So you first of all must find out
Yes.
what a randomized control trial is.
Okay.
What steps are involved in it? Okay, what is
Okay.
the method of recruiting your participants? Okay,
Yes.
and what goes into ethical considerations.
Yes.
Okay, and then what at all does the study intend to achieve? Okay, so for that one, that will be based on the particular paper you are given.
Okay.
The aim of the study will be based on the particular paper you are given.
Yes.
Okay, so in general,
Yes.
let's try and get to know when a study or a test needs to use a randomized control trial, when
Okay.
the design has to be a randomized control trial.
Okay.
Okay, so um, randomized control trial, let's break the words down. When we talk about randomization, it comes in the method of selecting your population
Yes.
and then your participants.
Okay.
Okay, so your population is the bigger group you intend to
Yes.
study.
Yes.
So then the participants are subsets of the population, the
Okay.
bigger group. That falls into your inclusion criteria. So inclusion criteria are the characteristics of that population, okay, that is relevant
Oh,
to your aim of the study.
yes.
Do you understand that?
Yes.
Yes. Okay. So um, randomization means that those participants have equal chance of being selected.
Okay.
There's no form of bias, and they are not selected probably by the author or the investigator's preference. No, they are all given a chance to be equally selected.
Okay.
Okay, all right. And then control. So now, first of all, randomized control trials.
Yes.
Okay, okay. First of all, let me ask you: when you hear trials, randomized control trials,
Yes.
what comes into your mind?
A test.
Hmm.
Yeah.
Yes. So, as a prospective study,
Okay.
so it has not really been approved yet. It's still in the process of trying to um, measure the efficacy, the efficiency, or the performance
Okay.
of an experiment, an intervention, or a product.
Okay.
Okay, so whenever you want to measure the performance of something in a
Yes.
study, it is advised that a randomized control trial is the best method to use.
Okay.
Do you get it? Okay.
Yes.
So in doing so, when you want to critique a paper that use a randomized control trial, okay, in its method and methodology, then what you're going to do is that you are going to critically evaluate the steps it used. So it's not about the findings of that particular study, no, but the steps, the procedure it used.
Okay.
Okay, first of all, the aim of that study,
Okay.
whether it is in line with the design it is using, which is a randomized control trial.
Okay.
Okay, then their method of recruitment, was it really randomized? Does it um, go in line, or does it reflect a characteristics of randomization? Do you get it?
Yes.
If I'm using a qualitative study,
Yes.
I would probably be looking at putting together the experiences of individuals,
Okay.
maybe their thoughts, their perceptions. Okay. So in that wise, if I use a qualitative study
Yes.
for a topic that is about experiences of individuals, then it's good. You get it? Because qualitative studies, that's what it is used for.
Yes.
But
Yes.
if I want to study about, let's say, let me use the performance
Yes.
of a new product, a new drug
Yes.
that should help control blood glucose level
Okay.
on the treatment of diabetes.
Yes.
Then I go about using just a quantitative method of
Yes.
data collection.
Okay.
Do you think if I use a quantitative method of data collection, I'll be able to measure the performance of that? Or let's say, if I use a qualitative study, I'll be able to measure the performance of the new drug. Do you think
No.
so?
No.
No. Why?
Because I think the qualitative is related to humans feeling.
Yes.
Yes, and I think the RCT is the best.
Yes.
Yeah.
Okay, that's great. Okay. So now, with a simple understanding about the RCTs,
Yes.
that's I'm repeating it again, or emphasizing that for RCTs, method of selecting the participants, they must all have equal chance of being selected.
Okay.
All right. Okay. Then we must establish the interventional group. The interventional group is also called the experimental group.
Yes.
Okay. Then we must also have a control group.
Okay.
Okay, so a simple analogy would be this. So I have plant A and plant B,
Yes.
right? And let's say we have a plant, this is a plant liquid,
Yes.
okay, that we want to measure how effective it
Okay.
will promote the growth of a plant as a
Okay.
new product. So here, my plant A,
Yes.
okay, will be my experimental group.
Okay.
I'm using experimental or interventional. That is, I'm going to use this new product or this intervention that I want to assess its efficacy or its efficiency. I'll use this and probably pour it, not probably, I'll pour it onto the plant.
Yes.
Okay. And then for plant B,
Yes.
I'll decide not to pour this onto it.
Okay.
So in that wise, plant A becomes my interventional experimental group
Yes.
because it has the experiment,
Yes.
what I am seeking to measure its performance.
Okay.
Okay, it has it. So it becomes an interventional group
Yes. Yes.
or experimental group. Then
Okay.
it becomes a controlled group
Okay.
because I want to see if this one does not have my new product, how will it also grow?
Yeah.
All right.
Okay.
In other studies, they can go forward and have a placebo group.
Oh yeah.
Yes.
Yes.
Okay. So that one, you could have maybe a manipulation done to that group. So maybe for that placebo group,
Yes.
we would probably have maybe a higher level or a high amount of this
Okay.
of my products, and
Okay.
probably another plant's food, okay, based on the weakness I find from my first two experiments or from my first experiment. Do you get it?
Yes.
It's
Yes.
trying to solve. When I was done with this one, and I got to know, oh, okay, my product is good.
Yeah.
Okay, but I think maybe when I add another plant nutrient, it will be better.
Okay.
Then I can decide to introduce a placebo group.
Yes.
Okay.
Okay.
And I add that new product. I think it will enhance my product to it. And then I'll study how the plant will grow.
Okay.
Okay. So these are the groups in randomized control trials.
Okay.
Okay.
Yes.
So now, when we are critiquing,
Yes.
as I said earlier on, it's about the method and
Yes.
then the methodology there. researchers used in writing their study.
Yes.
Okay, yes, or not just writing,
Yes.
but the what they used in trying to put together their study.
Okay.
So, first question. So here, this is the paper we would
Yes.
critique,
Thank you.
and this is your part two. You're only going to use the number one so that you have an idea of how to
Okay.
start with it. Can you read the first one?
Okay.
This
The
other side,
first
yes.
one is the study address a clearly focused research question.
Okay, so it is asking us that the study addresses clearly focused research question.
Yes.
Okay,